gets the lives in these. Yeah, sorry. It's a good thing. It's a good thing.
Okay, so we're now kind of live. So I can just ask you, what have you got from the day so far, and what are you hoping to get from it this sort of second day at CLAS?
Okay.
Right. Well, today I'm very new to the aesthetic practice.
And apologies for the audio, but you'd need to speak pretty loudly.
Right. For myself, I'm very new to the aesthetics practice, and it's about the eye area, which is, again, a whole new area for me, and how you can enhance that for patients.
I mean, I thought it was amazing. The person who talked about eyebrows earlier on, when he stood up, I thought that guy has amazing eyebrows, though I didn't know why.
Yeah.
Only to find out that he'd had his eyebrows lifted.
Exactly.
So I thought that was very interesting. I think also because Oriental people, I mean, our skin, our skin colour often can change, but our hair colour can often change, and that helps distinguish us.
Yes.
In a part of the world where everybody has sort of dark eyebrows, dark hair, then I guess there are going to be other things that are going to be significant.
And distinguishing features,
Yes,
if you like. Yeah.
Yes.
I was quite surprised, but it was quite interesting, wasn't it, to look at the variety of eyebrows, but there seems to be a bit of a consensus.
Yes.
And
yeah.
I appreciate what he's saying about being perhaps a bit older and lifting his eyebrows to give him that youthful look.
Yes.
I think it's very brave of him to admit to that as well.
I would agree.
Just another aspect that I thought of as well is that culturally it might be very significantly very different depending on what part of the world you're in. For instance, in Asian culture that might be completely accepted and it could be the standard. You know that we are in the West can completely frown upon because it doesn't work with us at all, you know, and especially like yesterday's class as well, where they were talking about noses and things like that. In some cultures, something that would be completely accepted in one part of the world might not be accepted at all in this part of the world. So it'll be interesting to see if he did the classification, and it turned out that the classification was consistent, you know, even in the East, even when they brought in the British Vogue scale that they made up. But interestingly, it was only female patients.
Exactly, but did you not think the eyebrows of the Anastasia were quite male eyebrows? You tend to associate the straighter.
Yeah, they were. It's hard to see if you only have pictures of the eyebrows and the nose and the eyes. You don't have the full face.
Yeah.
So maybe if you see it on a person's face, it makes sense, you know?
Yeah.
The pictures that they had, obviously, they based it off pictures of people. When we looked at them, they kind of looked strange to me, but it's because it was just the outlines.
Yes.
But it would be interesting to see if you could have that across genders. Is it still accepted in men too?
Yeah.
You know, because the defining difference between a male and female facial expression is the eyebrows. Women have an arched eyebrow, men have more of a flat eyebrow.
Exactly. Yeah.
So, I don't know.
I think you're right, but also if you look at the Asian sort of face, you get this very much a heart-shaped face, don't you? And whereas if you put it on perhaps a Caucasian long face, you might want a different sort of shape of eyebrow.
Yeah.
But then, as you say, it was very much across the board the preference.
Yeah, but it was very interesting so far, and the eyelid talks after that as well was I found quite interesting, especially the areas where, you know, it's one area where not everybody specializes, and you know, people tend to stay away from it or send it to the expert and never really become expert themselves.
Yeah.
And so this was good, like, foundation knowledge. Like, you know, if I approach it in ABC, this is what I should start with, and then work up I thought that was really interesting.
I'll be very interested in the application of hyaluronic acid, etc., because it's a very vulnerable area around the eyes. And I think that's why it is more the experts' department, isn't it, rather than someone as a beginner such as myself.
No,
What did you think of, Dr. Nasser talked about dysmorphia
Yes.
and about not only patients that you might want to treat, but some of the pitfalls that sort of lie along the way for patients who are, let's say they might have sort of they might have sort of psychological issues as well. So what was your kind of thoughts around that?
So I think it's something that every person, every doctor who wants to do cosmetic medicine, you have to read up on, especially body dysmorphic syndrome, because I can almost feels like every second patient that comes in has that, and then it would be morally wrong if you didn't take a proper history to identify the psychological issues to do a procedure on a patient like that.
But don't you think the tendency of people who want to look perfect, they tend to be perfectionists, they're probably very, very fussy, and they may be more towards the body dysmorphic personality, if you like.
That's true as well, which will all come out from if you take a proper history, to try to separate those.
Yeah, right, that's right.
Great. Well, I can see we're about to go back in, so thank you both very much for your input.
Thanks very much.
Thank you.
Thanks.